Welcome back to the Pharma Tutor. If you're preparing for the PTCB Pharmacy Technician Certification Exam, or PTCE, this video is for you. Today, I'll walk you through the entire 2026 PTCE syllabus. Not only will I explain each section, but I'll also give you examples so you can connect the topics to real-life pharmacy practice. By the end, you'll know exactly what to focus on to pass with confidence. Let's get started. Section 1. Medications. 35% of the exam. The biggest part of the exam is medications, making up more than a third of your score. This section expects you to know generic and brand names and classifications. Example: lisinopril is generic, Zestril is brand. It's an ACE inhibitor used for hypertension. Therapeutic duplication, knowing when two drugs treat the same condition, like atorvastatin and simvastatin for cholesterol. Drug interactions and contraindications, for example, warfarin interacting with many antibiotics. Strengths, doses, dosage forms, and routes. Think tablets, injections, inhalers, side effects and adverse reactions, metformin causing GI upset, or opioids causing constipation. Storage and stability. Insulin's in the fridge, nitroglycerin protected from light. This is where flashcards and cheat sheets will really help. Section 2. Federal requirements, 18.75%. Next is federal requirements, almost 1/5 of your exam. Here, you need to know the rules. How to handle hazardous and non-hazardous drugs safely. DEA rules for controlled substances. Like C2 medications such as oxycodone cannot be refilled. REMS programs for high-risk drugs like isotretinoin. Medication recalls and FDA's Drug Supply Chain Security Act, which ensures every medication can be tracked and traced. Think of this section as the law and order of pharmacy. Section 3. Patient safety and quality assurance, 23.75%. Almost a quarter of your exam is about patient safety. This focuses on preventing medication errors. Learn LASA drugs, look alike, sound alike, like hydralazine versus hydroxyzine. Error prevention strategies, tall man lettering, avoiding trailing zeros, using barcodes. Know when to involve the pharmacist, such as when a prescription dose looks unsafe. Understand event reporting, like MedWatch or VAERS. Infection control, proper hand washing, cleaning counting trays. PPE. A good tip here is to practice reading prescriptions carefully and role-play scenarios. Section 4. Order entry and processing, 22.5%. Finally, order entry. This is where your math skills come in. Be comfortable with formulas, ratios, proportions, and conversions. For example, converting teaspoons to milliliters, or calculating IV flow rates. Learn SIG codes, BID, TID, PRN. Understand equipment, insulin syringes, nebulizers, spacers. Pay attention to lot numbers, expiration dates, and NDC numbers. And know how to return or dispose of expired medications. This section is hands-on. The best prep is to practice calculations daily. So let's recap. The PTCE syllabus has 4 domains. Medications the largest at 35%. Federal requirements 18.75%. Patient safety 23.75%. Order entry 22.5%. If you master these areas with examples, practice questions, and cheat charts, you'll be ready for the exam. Thanks for learning with the Pharma Tutor. If this helped you, don't forget to subscribe, like the video, and share it with your classmates. In the next video, we'll go deeper into medication classifications with fast memorization tricks. See you there.